Well, as South Africa commemorates Youth Month, a month that shines a spotlight on challenges and struggles that are faced by the current youth, as opposed to the ones that were faced by the youth of 1976. Health-related issues have been identified as one of the many challenges faced by today's youth. These include issues of mental health, COVID-19, HIV and AIDS, and peer pressure. Let's get more on this when I joined via Zoom by Rodney Makube. He's the Chief Operating Officer at Rhiza Babuyile. Thanks very much for joining us, Rodney, and a very good afternoon to you.
Good afternoon to you and to your viewers.
Let's talk then about some of those struggles that perhaps are sort of overlooked, those that include mental health issues and health at large. I mean, you know, we talk so much about, problems pertaining to jobs, a lack of jobs for the youth. We had graduates last week who were complaining about the lack of jobs even when you've graduated. But, all of this and it also contributes to the issue of mental health. How is that really affecting the youth at this time?
Thank you. So there is definitely a very negative effect on the young people, because you can imagine that as young people grow, they look forward to getting jobs, being employed, taking some responsibility, earning your own income. But unfortunately, in the present economic climate, that is quite different. So we're seeing more young people depressed. As Rhiza Babuyile, in our centers, we do psychosocial support. And with that, we are seeing more young people coming in, showing some signs of depression, showing some signs of hopelessness, showing some signs of psychologically giving up to practice that one would think they are available in the dispensations that we are living in.
Yeah. Rodney, I mean, sometimes, especially given the fact that we're talking about young people, we're talking about youth who might not be able to, or might not have the tools, as to how to handle issues. I mean, even grown, even adults struggle with that. So, what are some of the issues that, you're faced with when you do work with the youth? Because some of them don't know how, or don't have the tools to deal with these particular issues. I mean, you mentioned depression, for example, and, I wonder if some actually turn to things like alcohol or abusing drugs. I mean, what are the bad coping mechanisms that you've had to then deal with?
I think as a society, we need to admit that we are dealing with the enemy that we are not used to. And there are some of the myths in our culture, for example, that if you have to go and seek for mental health, that something's wrong with your mind. If you are seeking psychological support, something's wrong with you. So that myth also increases the challenges that we are facing. But I think as young people, we need to understand that seeking for psychological or emotional help is quite healthy. It's your emotional health is as good as your physical health. As much as you go to a clinic, if you've got flu, to get some injection, equally so if we've got emotional challenges, it should be okay to go and seek help from anyone within the community who is in a right position to do so. And of course, we see more young people trying to find ways to cope with this, and definitely not only young people, older people equally so, that using drugs, using alcohol, is one of the ways that young people or people are using to cope with the pressure. Unfortunately, that is depressant. It just depresses their pressure for that particular time, but the next morning we're still facing the same challenge. And the encouragement that we want to give our young people is that it's okay to go and seek for emotional help. It's not a sign of weakness, it's a sign of strength, because the best way that someone can grow emotionally is firstly to recognize that you've got some challenges that you are facing. Is to recognize that you are not focused. I mean, you are not functioning optimally. That you need someone to support you. You need someone to help you. You need someone to talk to. And one would also understand that we are living in a very broken society. So in the past, one can say, I can speak to my mom, I can speak to my uncle, but that support system within our community is no longer there. Young people are living by themselves. they are only supported by their friends. Not everyone have a privilege of speaking to a family member who can support them. So I think with the services that we have, like with Rhiza Babuyile, a number of services that many NGOs have within our community, it's up to the young people to make use of those services because they are meant to empower youth.
Yeah, we're not just talking about mental health. We're talking about, other health issues. There's an increase in HIV and AIDS amongst the youth. And then, of course, they've had to deal with the COVID-19 pandemic, not only on an emotional level, but, losing friends, losing relatives. I mean, let's talk about how that adds to the anxiety and the stress that, our current youth is having to undergo. And on the back of that, I think it's important for you just to let us know how those who want to reach out to you would be able to do so, because I think there is quite a gap and a need for services that you offer. Yeah,
so of course you are correct that depression and maybe mental challenges is isolating the problem, that they are in number of levels. You're looking at physical health. Even after COVID, you're looking at people who were taking medication for HIV, but who have actually defaulted due to the number of lockdowns that we have experienced, which have compromised many people's immune system, which becomes very much important that people, all of us, we should take our physical, emotional, psychological wellness very important, that we should be free to go to the clinics for a checkup, to say, how am I doing? Whether you are a man, whether you are a woman, we have mentioned those type of factors, but we also know that the rate of teenage pregnancy have increased. And we know the impact of teenage pregnancy with regard to access to education, access to jobs, access to higher education. We know that it has a limiting factor. So that also have increased. With COVID-19, it has not only increased. We saw a high number of children being murdered by their own parents. And that we can also talk to stress, pressure, depression. But in a nutshell, what becomes very key is for us as young people know that we firstly need support. We need help. We cannot do it on our own. And where can we get this type of support? Our local clinics are in a position to help us. You can go to a clinic, you can check your vitals. If you have defaulted, you need to communicate to say, this is the medication I was taking, I have defaulted. Access to social workers, the hospitals have got access to psychologists. Our clinics, we've got access, as Rhiza Babuyile, we've got access to nurses, we've got access to psychosocial support. So what is key is for us, for young people not to stay in our own homes, and we know what we are going through, is to encourage each other to approach any government office, particularly in this case, we're talking clinics, we're talking social workers, to approach and say, this is where I am, and seek help. Because if young people are not seeking help, we have seen youth suicide increasing drastically from last year. And we know that it is increasing even at this point in time. So what is key from me is to say, let's go to those offices, let's ask for help. Our clinics, our local NGOs, they are there for us to be able to access services.
All right. Thanks very much, Rodney Makube, for speaking to us. And of course, thanks for the work that indeed you are doing. So that's Chief Operating Officer at Rhiza Babuyile. We're going to take a short break. More news after this.